Hello. This presentation is on abuse, neglect, and exploitation, and it's presented by yours truly, Michael Allen. The training summary today is this presentation will cover the signs of abuse, neglect, and exploitation. The presentation will assist you with what steps to take if and when you sense an individual being victimized by a perpetrator. The objectives of this training are understanding the rights of the person served, identifying the population who is at risk, and identifying what is physical abuse, sexual abuse, and the role of verbal and nonverbal indicators, and the staff's role in preventing abuse. So, first, we want to understand the person's rights. Ask yourself, do you understand the right of the person and the people that we serve? Report of abuse, neglect, and exploitations are filed often because of the lack of respect and knowledge of a person's individual rights. The rights of a client. Some rights include nutritionally sound diet, unrestricted access to food, water, and bathrooms, choice of appropriate clothing, enjoyment of quality goods and services, declining any service or support, daily recreation of ex and rec, I'm sorry, daily recreation and exercise. At-risk populations of abuse, neglect, and exploitation. Older women most commonly reported, higher the age, greater the risk. Individuals living in an institutional setting, physically frail, or persons with disabilities, confused, disoriented, or mentally impaired individuals suffering from grief, a person with communication skill deficit. These are some pre-activity. And normally when I'm doing this presentation, I would provide the description and then ask the participants within the group setting, which one is it? Is it abuse, neglect, or exploitation? So the first one is manipulation to spend personal funds. That's an example of exploitation. Malnourishment and poor nutrition is an example of neglect. Over medication or over sedation is an example of abuse. Ridicule, humiliation, scorn, and harassment, an example of abuse. Forging documents is an example of exploitation. Dehydration is an example of neglect. Abuse. It's the intentional or reckless infliction of serious physical pain or injury, the wrongful treatment of an individual which endangers his or her physical or emotional well being through the actions or inactions of anyone. It's also the failure of exercise one's duty to intercede on behalf of an individual also constitutes abuse. Striking with or without an object is an example of an abuse. These are also examples of abuse. So I'm going to go clockwise. Sexual, mistreatment, self abuse, verbal, and psychological and physical are all examples of abuse. So physical abuse, physical physical contact with or handling of an individual with more force than is reasonably necessary for the safety of the individual. Examples include grabbing, shaking, dragging, shoving, yanking, slapping, hitting, choking, pinching, biting, strangling, and punching. Abuse indicators: over medicated and over sedation, broken bones, sprains, fractures, matching bruises on both arms, untreated and unexplained injuries, missing hair or teeth, rope or strap marks on limbs. Individuals cannot explain how they got hurt, numerous hospitalizations for injuries. Sexual abuse. Any sexual activity or attempted sexual activity between individuals and a provider's employee or family member, regardless of the individual's consent. Any sexual activity or attempted sexual activity between an individual and another person, including another individual where the individual does not or cannot give consent. Sexual abuse defined. Sexual activity includes touching or fondling the genitals or other intimate parts of an individual, causing an individual to touch him and herself or anyone else, whether directly or through clothing, for the purpose of arousing or gratifying the sexual desires of any party. Taking sexual explicit photographs of an individual. Inappropriate sexual acts include sexual activity includes causing an individual to perform sexual explicit acts, showing an individual pornographic material, encouraging an individual to use sexually explicit language, which he or she may not fully understand, sexual assault and battery, rape, sodomy, and coerced nudity. Sexual abuse indicators: trauma to the genital area, sexually transmitted diseases, infections and unusual discharge or smell, bruises around the breasts, clothes with bloodstains, tears, marks, soreness around breast, genital, and anal area, difficulty walking or sitting, individual reports being sexually assaulted or raped. Sexually abused children have both emotional and physical reactions to their abuse, more likely to have physical health problems, report more school problems, more likely to experience major depressive disorder as a result. Girls are more likely to develop eating disorders as adolescents, more likely to develop alcohol and drug addictions. Use of verbal and nonverbal expressions or other actions that subject individuals to ridicule, humiliation, contempt, scorn, harassment, threats of punishment, dehumanization, wrongful manipulation, or otherwise degenerating or socializing, stigmatizing. Verbal psychological abuse indicators: significant weight loss, gain not attributed to other causes, stress related conditions, sleeping problems, exhibits depression and confusion, cowers in presence of abuser, emotionally upset, agitated, withdrawn. Staff's role in preventing abuse: knowledge of individuals. You need to know these individuals. Profile of the medications that they take, behavior support plan if applicable, history of serious reportable incidents. Neglect. Active neglect, caregiver intentionally withholds care or necessities, passive neglect. Caregiver is unable to fulfill their caregiving responsibilities. Examples of neglect: the failure to report or act on health problems of an individual or changes in his or her health conditions, the failure to prevent sufficient, consistent, or appropriate services, treatment, or care that harms or jeopardizes the individual's health, safety, or welfare. More neglect examples: lack of attention to the physical needs of an individual, including personal care, hygiene, meals or appropriate nutrition, shelter, and safety, failure to carry out a plan of treatment or care prescribed by a physician or healthcare professional, and lastly, failure to provide services or supports as indicated by the individual's plan of care. Who neglects? Failure to provide proper supervision to the individuals as required within a plan or by a court. Neglect may be at the hands of the caregiver, or it may be self-neglect. What is self-neglect? Self-neglect is not considered a crime. This is a desire of the person to neglect himself or herself of proper care and services. However, we as supporting staff should advocate for the best interests of the person. Severe self-neglect, domestic squalor, hoarding behaviors, clutter, filth, inability to discard possessions. neglect indicators: malnourishment, dehydration, pressure sores, chronic health problems, unclean and unsafe living conditions, individual begs for food, wandering without supervision. Neglect indicators include poor personal hygiene, including soiled clothing, dirty nails, skin, matted or lice infested hair, odors, presence of feces or urine, dirty bed linen, skin rashes, clothed improperly for the weather, medication mismanagement, animal and insect infestation. Financial or material exploitation: the illegal or improper use of an individual's funds, property, or assets for one's own monetary, personal benefit or gain. Coercion of manipulation of an individual to spend their personal funds for things individuals may not use for. Soliciting gifts, funds, labor, or favors from the individual. Financial or material exploitation: cashing an individual's check without authorization or permission, forging an individual's signature, misusing or stealing an individual's money or possessions, coercing or deceiving an individual into signing documents such as a contract or a will, etc. These are some descriptions, and I will go through it to identify: is it abuse, neglect, or exploitation? First description: failure to carry out a treatment plan by a health professional, that's neglect. Failure to provide proper supervision to the individual is an example of neglect. Cashing the person's check without permission, exploitation. Unexplained injuries, numerous hospitalizations for injuries is abuse. Soliciting gifts, funds, and labor is exploitation. Showing the client's pornography is abuse. Serious reportable incidents: instances of abuse, neglect, or exploitation is documented as a serious reportable incident. You have to report these things. A death, allegations of abuse, neglect, serious physical injury, serious medication errors, improper use of restraints, theft of personal property or funds of individuals. Notification for serious reportable incidents other than death, emergency personnel as needed via 911, the immediate supervisor or manager on duty. Notification for serious reportable incidents other than death, the Adult Protective Services. You want to contact, this is the number to Washington, D.C., but I will provide you with the number for the state of Maryland. The individual residential provider, the individual therapist, the case manager within Therapeutic Connections will be provided the actual number to contact. Grassroots is our local crisis hotline to utilize, or you can definitely provide that information to the individual's social worker. At this time, it's open to any questions or discussions. As I shared earlier, the number that we use in a crisis is Grassroots. That phone number is 410-531-6006. Again, the crisis hotline number to contact if you suspect any abuse, neglect, or exploitation is 410-531-6066. Thank you.